When did you guys first meet?
1987. He came on vacation from Italy and came for a car ride, and that's how we met.
I decided to quit my job, leave everything, and come back, and I asked her to marry me.
And here we are, 35 years later. In October of 2021, I got a scrape on my right leg that went septic. I've made several emergency room visits, spent hours. At the end of October, I woke up one morning and I went into organ failure. I was put in the ICU. I was there for 2 months. I probably wouldn't be here today if it wasn't for this man. He never left my side. Since this experience, I am taking anti-anxiety medications now, sitting waiting in the emergency room. It's horrible on your mental health.
We are the busiest single-site emergency department hospital in Ontario. We see between 350 and 400 patients per 24-hour day. And with that, we need to ensure that everyone's condition is seen and, most importantly, delivering a standard of care to them that is top-notch.
As a patient coming into the ER, you don't know whether you're high acuity or low acuity. You know something is wrong with you, and you are coming somewhere looking for help. And that makes you vulnerable. At Humber specifically, we have a large percentage of people that would have a high resource demand on our healthcare system. A large percentage of our patients would be classified as low income. A large percentage of our patients don't speak English. And the ED is a stopgap measure in the system. And so many of our patients also don't have access to primary care. And so they use the emergency department for that resource.
In all the time that I've been to the emergency room, what I've noticed is everybody's chasing the nurses, so trying to chase the doctors, not giving them enough time just to do their duties, their work.
We like to think out of the box. We have a lot of technology capability in-house already, and we have a very busy emerge. Pre-pandemic, we had the idea that, why should patients sit and wait in waiting rooms? Why wouldn't we try to set something up so that patients can actually wait in a private and comfortable setting rather than waiting in our waiting rooms? We would be a great candidate to try to prove this out as a concept so that not only for us, but for the whole of the province and ultimately everybody.
The AI queuing tool is actually a natural evolution from the command center. We have all kinds of data that tells us what time of day we're busy, when the ambulances come, how long we're waiting for lab results. And so we really understood giving the patient information. We know when people have more control over their environment, they're less nervous and they tend to have a better understanding of what's going on with them.
The whole point is twofold. The first is to optimize flow in the emergency department, and the second is to improve patient experience. And the way that it does this is that the artificial intelligence model digests both historical and live information and feeds it through the model and then generates a time which is ideal for the patient to safely arrive at to minimize the amount of time they have to wait in the emergency department to see a physician.
One of the things that is a burden on both the patient and us is capturing information about the patient when they arrive. You go to the ED and they say, so what's your problem? And often that's stressful because you're trying to remember or you're in pain. It's a little bit of a pressure cooker. Another thing that's classic is, what medications are you on? Why not allow them to capture that by taking pictures of the bottle of the medication in the comfort of their home? And that's going to really make a difference to the experience for the patient and for us to start planning before you even turn up.
We are asking donors to give to the Digital Vision to improve care. And the donation to Digital Vision and helping us to design and implement these tools and train people on how to use them is the kind of thing that's a game changer in healthcare.
When I'm sitting in Emerge, beginning to panic, it actually makes your condition worse because you bring it upon yourself. All of that comes into play because you're not in control. And the app, believe it or not, will give you back some of that control.
It is an amazing safety net because the peace of mind alone is great, absolutely insane if you think about it. Once you're home and you know that your loved one is not in any real danger, then you can relax and say, okay, now let's see what we can do.
Let's wait.
Let's wait.
We may as well wait.